Hello, welcome to the Thyroid Pharmacist Healing Conversations podcast. I'm your host, Dr. Izabella Wentz, PharmD. Today we're going to be getting into thyroid symptoms. Now, probably one of the most common symptoms that people with thyroid issues complain about is going to be excess weight. And the usual strategies recommended by fitness bros and even some of our healthcare practitioners, such as eat less and exercise more, don't quite cut it when you have hypothyroidism and a slowed metabolism. One of the things that happens with hypothyroidism, it slows down our basal metabolic rate, which is essentially the amount of calories that we burn at rest. So that means we could be eating the same type of diet and exercising the same amount as one of our friends without hypothyroidism, but we would be putting on weight, whereas the other person might be maintaining their weight. So I want to share 11 strategies that may help with weight management with hypothyroidism and Hashimoto's. So first and foremost, thyroid function. Thyroid function is so important for that basal metabolic rate. If you've been diagnosed with hypothyroidism and you haven't had your thyroid function tested for quite a bit and you're struggling with a weight issue, this is going to be your sign to get tested, to get your latest lab values. Oftentimes I see people get started on thyroid hormones, but they're not properly optimized on thyroid hormones. The reference range where I like to see TSH, thyroid stimulating hormone, at would be 0.5 to 2. Now, some doctors will let it go as high as 4, 5, 6, 7, 8, 9 before they adjust medications. And so this is something to consider. If your TSH is too high, this could be causing you not to have a proper metabolism. The other thing to look at and to consider would be your levels of free T3 and free T4. These are your thyroid hormones that are available to interact with your receptors. Now, most people that take thyroid medicine, they take a medication known as levothyroxine. It's also known as T4. T4 is metabolically active, but the more metabolically active thyroid hormone is actually T3. And you can take that as a medication as well. Liothyronine is the prescription medication. Brand name is Symptom. You can also utilize that as Armour or natural desiccated thyroid medication. Typically what can happen in some people is that they take T4 containing medications and their body doesn't convert enough of the T4 to the T3 hormone. And T3 is the more metabolically active hormone, and that's going to be helpful for giving you brain function, for stabilizing your metabolism, for giving you great hair. And a lot of times people will say, okay, I was on a T4 containing thyroid hormone, but when I switched to a natural desiccated thyroid product, or my doctor added some T3 to the mix, then my metabolism really picked up. And a lot of these thyroid symptoms, including the weight loss resistance, brain fog, fatigue, depression, hair loss, they actually got better with that. So I encourage you to look into that if you're still struggling with weight gain despite being on thyroid medications. The other thing to consider is the type of diet that you're eating. A lot of times if we're eating a very carbohydrate heavy diet, this could result in us having insulin spikes. Now, insulin is our fat storage hormone. And every time our insulin spikes, our body gets the message that we need to store fat. And so many times people find that by adding more protein and fat to the mix and minimizing carbohydrate intake, this helps to stabilize their insulin levels, and their body doesn't get the message to store fat as much, and they're able to essentially lose weight while eating a similar amount of calories. And they also stay full longer and they tend to feel better. We know that blood sugar imbalances are a really, really common part of hypothyroidism and Hashimoto's. And a lot of times the blood sugar swings can actually drive anxiety, panic attacks, fatigue, weight gain, as well as those thyroid antibodies. Many of the thyroid diets that I found to be very helpful do tend to be lower in carbohydrates and richer in protein and fat compared to the standard American or the standard Western diet. Few rules of thumb of things to consider if you are looking on getting on a healing diet. You want to minimize your sugar, processed foods, potentially corn, rice, grains. These are all things that can really mess with our blood sugar. We want to focus on eating plenty of good meats and vegetables, increase our fiber intake, good fats such as avocados, olive oil, and coconut oil. For protein purposes, getting more protein into our diet can be a really, really important consideration if we're aiming to lose weight. Protein is going to be helpful and supportive of metabolism in a few different ways. One of the ways is that there's the higher thermic effect of food. So essentially, we need more energy to digest and metabolize protein compared to carbs and fats. So this gives us a natural caloric boost, right? And so we burn more calories when we're eating protein. Protein also supports our muscle maintenance and growth. And it also is a rich source of essential amino acids, which help us with detoxifying various chemicals. One of the reasons why some people may struggle with excess weight is because they can have a very heavy toxic burden. Many toxins actually dissolve in our body fat. Protein can also be helpful for blood sugar and appetite regulation. Typically, if we're eating carbohydrates, our blood sugar can spike up very quickly and come crashing down, making us hungry again. But if we're getting enough protein and fat, that keeps us full longer, stabilizes our blood sugar, and reduces those insulin spikes. And then we also find that our muscles are more likely to stay on board even if we are losing weight. One of the challenges that people often experience when they go on like a low calorie diet to lose weight is that they will oftentimes lose muscle instead of losing fat. And making sure you get enough protein can safeguard you against that. Another one key thing to consider is the amount of protein that you're getting. This can vary depending on your activity level. Typically, we hear about bodybuilders needing to get more protein. Recommendations, for general health purposes might be 0.5 to 1 gram of protein per day for each pound that you weigh. Of course, if you're more active, even if you're older, you might need some higher requirements closer to that 1 gram per day of your ideal body weight for weight loss. So for many women, that looks like 30 to 40 grams of protein with most meals. One of the things that I really love to utilize is utilizing protein shakes. They're a really, really tasty way to get your protein requirements in. I created organic pea protein as well as an autoimmune paleo-friendly hydrolyzed beef protein that now comes in unflavored, vanilla, and chocolate. So I'll link that for you guys in the show notes. Another great way to get some protein into your body is by drinking bone broth. You can make bone broth by yourself. I'm going to link to my YouTube video on how to make that. But essentially, you take some bones. Ideally, I like to use like drumsticks that have a little bit of meat on them. You take some veggies like carrots, celery, onions, a little bit of apple cider vinegar, and cover that in water in a slow cooker and let that cook for 12 to 48 hours. And that broth is actually going to have about 15 or so grams of protein per cup. And this is going to be something that you can sip throughout the day to increase your protein intake, keep your blood sugar stable, as well as provide your body an opportunity to really support your gut lining and your detoxification. This is one of those life hacks that's really, really helpful for maintaining a healthy weight. So we're going to be less bloated. Our skin's going to look nicer. Our hair is going to be nice and shiny. I really love a book by Dr. Kellyanne Petrucci. I'm going to link it in the show notes. Another thing to consider would be looking at food sensitivity testing. Many years ago, I came across a book that was called Are Your Hidden Food Sensitivities Making You Fat? Was roughly the title. It was kind of a weird title, but the premise of it is that food sensitivities can cause inflammation, which then of course can cause us to retain extra weight. So this is something that I have seen in practice as well, especially with like bloating symptoms, and looking at what foods you're sensitive to can be very helpful. Generally speaking, most people with Hashimoto's, I oftentimes recommend gluten, dairy, and soy-free diet for 90 days or so to see if that helps to resolve most of your symptoms. And sometimes doing food sensitivity testing, such as the ALA test, food sensitivity test might be something you may wish to do. Blood sugar balance can be very, very important, and there are insulin resistance strategies and hacks, such as walking after meals can help with normalizing that. One of the things I love to utilize is a indoor treadmill or a walking pad. I never thought I would get one of these living in Colorado, Chicago, and California, and Europe. However, I live in Austin, Texas now, and sometimes it's just too hot to go outside to go for a walk, or the weather is just extremely harsh and unpredictable. And having something like this in your home can be a great way to get your steps in. Various guidelines have been given anywhere from 5,000 to 10,000 steps a day. I feel like anywhere in there, if that's healthy for you to do and it doesn't strain your joints and doesn't hurt you, if you could aim for that goal, that would be wonderful. You can use fitness trackers to support your goals. I have used the Apple Watch. I like that. And I know some people like the Fitbit. There's also supplements that you can utilize for blood sugar support. A few of my favorites that also have multitasking properties for people with hypothyroidism and Hashimoto's include berberine. This helps to support blood sugar balance and normal insulin sensitivity. About 1 gram of berberine per day supported fasting blood glucose sugar levels with people with diabetes. Now, this is something that's been studied for its ability to help people lose weight. Some people call it nature's Ozempic. I wouldn't go that far as to call it nature's Ozempic, but it has been shown to help people reduce weight. The other reason I like it is because it's helpful for SIBO, which can be a cause of weight loss resistance. And it does seem to help with healing the gut. In my experience working with people with Hashimoto's, a lot of times healing the gut is going to be very, very helpful for losing weight. The other supplement to consider would be myo-inositol. This is something that's been well studied in polycystic ovarian syndrome, but recently it's also gotten a lot of attention for its role in hypothyroidism. A small study found using myo-inositol with selenium could get subclinical Hashimoto's and hypothyroidism into remission, which I thought was really, really cool. Myo-inositol works by stabilizing blood sugar, and so a lot of times people do find that it produces weight loss benefits for them as well. Resistant starch is a type of carbohydrate that resists digestion, and it acts as a prebiotic for the good bacteria in the gut, which then shifts your microbiome so that it is healthier. Interestingly, a lot of times it's our microbiome that's responsible for how many calories we pull out of our foods. So what this means is if I have an unbalanced microbiome and another person has a really good and balanced microbiome, I could be eating the same amount of food, same exact foods, and my microbiome is going to be extracting more calories from my food versus another person who has a healthier microbiome. And resistant starch helps to sort of get that into balance. Some of the bacteria associated with SIBO, such as the Methanobacter bacteria, also tend to be very pulling of calories from our food. And so this is one of the reasons why I think SIBO is typically associated with weight loss resistance too. And of course, it produces that unfortunate bloating. Additional gut healing strategies would be probiotics, fermented foods. Saccharomyces boulardii is one of my favorite probiotics. I also love megaspore biotics. I also love lactobacillus and bifido-based probiotics. These can be very, very helpful in supporting your microbiome and getting it to a healthier state. Another reason why people may struggle with weight loss issues is going to be because of their stress response and their adrenals. And so if you hear of people talking about cortisol face and cortisol belly, so absolutely when we produce too much cortisol, that could lead us to accumulate fat in our bellies. Getting into adrenal balancing, this is going to be something that isn't always straightforward to do. Sometimes we might have major stressors that we need to work through, such as traumatic stress or ongoing stress that we need to deal with. But there are some foundational things we can do to support our adrenals. I really love talking about the ABCs, which are adrenal adaptogens such as ashwagandha, the B vitamins, high dose vitamin C, magnesium, and Epsom salt baths are some of my favorite things to utilize for adrenals. I have a product called Adrenal Support by Rootology that contains all three of those. Now, it's not for somebody if they have high blood pressure or high cortisol, but it is for people who are like the majority of people with hypothyroidism in that low cortisol state and they have low blood pressure. You can test your adrenals utilizing the ZRT adrenal stress profile or the Dutch test. These are two potentially very helpful tests that you can utilize. Another reason that may be causative for weight loss resistance, and I already talked about this, is going to be if you have a high toxic burden in your system. One of the toxins that's notorious for causing people to gain weight is mold. I remember some of my clients early in the days, they essentially would have just so much excess weight on their bodies when they were mold toxic. And cellulite is kind of a red flag for me that you're either dealing with estrogen dominance or something that's acting like estrogen in your body, which could be mold toxins, which act like estrogen, and some of these, chemicals in personal care items that can have estrogenic effects. Liver support, detoxing your liver support, so things like milk thistle, N-acetylcysteine, amino acid supplements, these can be very, very helpful for clearing out that toxic backlog. You can do that over the course of 2 weeks. A lot of times people that go through my liver reset program, they report that they do find weight loss just without even trying. They're able to lose a little bit of weight and they feel better and their muscles feel stronger. My other big recommendation is sauna therapy. If you feel good enough to get into a sauna, 30 minutes a day, 4 days a week, if you can do that just for 2 weeks, you're going to see some major improvements in your symptoms, as well as you're going to see a major improvement in your symptoms. If you can do 4 sauna sessions for 30 minutes a day for 2 weeks, you're going to be able to move out a lot of toxins out of your system, and you're going to feel so much better. Many people do report that their skin clears up, they have more energy, and they're also able to lose some weight this way. Now, of course, don't do sauna if it makes you feel worse. Generally speaking, all of these interventions should be making you feel better as you go through them. One of the reasons why sauna works so well is because most people with hypothyroidism, none of them will ever complain about this, but most of them can't sweat or don't sweat enough. So we do know that hypothyroidism lowers our metabolism and it lowers our core body temperature. And so we're just less likely to sweat. And sweating is one of the best ways to get rid of various toxins, right? And so if you get into a sauna, you're going to sweat. And this is going to be a great way for you to clear out some toxins. Sex hormone imbalances. This is a really big common reason why women in perimenopause and menopause start having issues with weight. I know this happened to me personally. I was personally victimized by this. Around age 38, I started perimenopause, and all of a sudden, I was just gaining weight out of nowhere. I had a very previously stable weight for many, many years. I had my son and returned to my pre-pregnancy weight within 6 months without really trying or doing anything special. And then all of a sudden, I felt like I gained 15 pounds overnight. It was more like, 2 months times worth. But estrogen dominance is typically what happens initially when we start perimenopause. This is because progesterone starts to decline. It's one of the first hormones that goes down in perimenopause in a woman's life. And so then we become imbalanced in our estrogen to progesterone ratios. We need to have just the right amounts to feel our best. And excess estrogen can cause us to put on extra weight, amongst other symptoms, of course. Some of the ways that we can hack this would be the liver support helps to detoxify some of the estrogen. We can utilize supplements depending on where we are in our perimenopause journey. I know seed cycling can be incredibly helpful for this. I really love the Bia brand. This can be helpful by using specific seeds at the beginning of our cycles that support, balancing estrogen. And then the second part of our cycle, they're supposed to boost progesterone. That can work really, really well for many people. Maca is another thing that can work quite well. Vitex is a herbal remedy that can work to increase progesterone levels. I've also found that it's very helpful for brain function, especially if you have like that perimenopause brain fog. And then some people will actually need supplemental progesterone. So whether that's a topical progesterone or an oral progesterone that's by prescription, again, depending on where you are on your perimenopause, menopause, hormonal journey, you might benefit from one of these interventions. For some people, it's utilizing more magnesium, more pregnenolone, utilizing perhaps more B6 or P5P to help your body produce progesterone naturally. I would say the younger you are, the less likely you're going to need oral progesterone or topical progesterone. But the older you are, there's only a limit of how much herbs and nutrients can do once you go through perimenopause and menopause. So sometimes that hormonal therapy can be very, very helpful to make sure that your progesterone and estrogen is balanced. And the testing you can utilize for that would be the Dutch Complete from Precision Analytical to see where your hormones are, as well as getting a blood test with your practitioner to see if you might have too much estrogen, not enough progesterone. And then, of course, physical activity can stimulate our metabolism. In addition to thyroid function, we also know that muscles can boost our metabolism, and our metabolism can depend on how much physical activity we're getting. So I just say choose an activity that you're going to enjoy, whether that's salsa dancing, yoga, Pilates, maybe going for walks around the neighborhood. I would say this is going to be one of your best strategies to keep it helpful and long-term. I do like the indoor treadmill. If that's all you can do, you can also get some weights, 5, 10, 15 pound weights, and do some muscle building reps. And you'll find that building more muscle can help support your metabolism in the long term. Another consideration is medication side effects. Now, if you have been prescribed psychotropic medications, a lot of them do have the potential to cause weight gain. So be sure to check with your pharmacist on that. I know I've seen a lot of times people get prescribed psychotropic drugs, like very strong psychotropic drugs for things like sleep, like Seroquel Even Zyprexa, I've seen used off-label for sleep, but those can be very much likely to cause you weight gain. So I would be very mindful of that. Antidepressants too, Prozac, Zoloft, Lexapro, Paxil, I've seen them contribute to weight gain. The exception to that would be the antidepressant Wellbutrin, which can actually cause a little bit of weight loss, or it tends to be more weight neutral. I would say this is probably my most favorite antidepressant for most people with Hashimoto's and hypothyroidism. And there is a version of that medication that's combined with like a lower dose of naltrexone that's used for weight loss. I wouldn't say it's the most effective drug for weight loss, but if you're somebody that is in need of a mood supporting medication, my likely drug of choice would be Wellbutrin. Last but not least, I would address your nutrient deficiencies. One of the most surprising reasons why people hold on to excess weight is because they're malnourished. Now, that seems like counterintuitive if you're overweight that you're malnourished. But yes, we can absolutely have cravings for different foods when we don't have the right nutrients on board. The chromium deficiency is one of the ones that's associated very much with weight gain. So making sure you're on a chromium supplement, especially if you're insulin resistant, this can be a very big game changer. I would also look into a thiamine supplement that can be very, very helpful. Some common nutrient deficiencies in Hashimoto's include B12, selenium, magnesium, vitamin D, and ferritin. And in some cases, we might need digestive enzymes to ensure that we're properly extracting nutrients from our food. We talked about a lot of things here. And if I were to summarize, I would say if you're looking to lose weight with hypothyroidism, some things to consider would be focusing on protein intake, focusing on fiber intake, prioritizing walking, working on an exercise that can help to build your muscles, whether that's Pilates, yoga, or lifting weights, supplements such as liver support supplements, berberine can be very helpful, resistant starch, myo-inositol. And I would also consider the supplement carnitine. Carnitine is something that can support fat metabolism by helping transport fatty acids into cells so they could be utilized for energy production. Oftentimes, a lot of bodybuilders do use that for supporting exercise endurance and for helping with building muscle. Hopefully these few thyroid weight loss tips will be a helpful part of your healing journey. Until next time, this has been Dr. Izabella Wentz with Thyroid Pharmacist Healing Conversations podcast.